7% daw ng mga working Filipino ang nakararanas.
Sa bawat sampung Pilipino ang nagdaranas.
Yung depression, gawa-gawa lang ng mga tao yan. Gawa nila sarili nila.
Oo, dinidepress nyo lang yung sarili nyo.
It's all another dimension. You say we're small and not worth the mention. You're tired of moving, your body's aching. We could vacate, there's places to go, clearly.
Hello everyone! Good morning! In this seminar, we will discuss about our mental health, specifically the depression and anxiety. I would like to express my gratitude for attending this seminar. But before we start our seminar, let us have an icebreaker. So, the members or the participants who attended this seminar will be divided into two groups to act 3 examples of symptoms of a certain mental problems or mental illnesses. So, let's start. The group 1 will be MJ Nazareno, Tristan J, Trisha Kaidoy, while the group 2 will be Crystal Allison Maka, Sofia Coral, and Romana Banaan.
So, good day everyone. So, today we will be talking about mental health, what it truly means, its scope, and even one of the most common misconception about mental health that many people still believe until today. So, before we begin, let me first ask you a question. When you hear the word mental health, what comes into your mind? Okay, thank you for sharing your thoughts. So now, let's explore this topic together. So, mental health, it refers to our emotional, psychological, and social well-being. It affects how we think, it affects how we feel, and even how we act. So, it influences how we handle stress, how we relate to others, and even how we make decisions in life. So, having a good mental health, it doesn't mean we're always happy, we're free from all the problems, but it means we can cope with life's challenges in a healthy and positive way. So when we take care of our mental health, we become more resilient, more confident, and balanced individuals. And for one of the most common misconception about mental health is that people with mental health problems are just being dramatic or they can easily control it. And this belief is not true. Mental health struggles are real conditions that affects person's thoughts, person's emotion, and even their behavior. So they are not simply mood swing or attention-seeking behavior, but just like physical illness, mental health concerns or requires understanding, compassion, and sometimes professional help. So by breaking this misconception, we can build more supportive and empathetic community for everyone. And now, let's talk about the scope of mental health. So, mental health, it affects everyone, regardless of your age, regardless of your gender, or even your background, since it affects how we think, how we feel, and behave in our everyday lives. So, now, let's take a closer look on how it affects in different stages in life. So, first is for the children. So, mental health affects how children learn and express their emotions, interact with others. So, when our children feel safe, and loved and supported, it helps them build confidence and positive social relationship. And next is for the teenagers. During their adolescence, teenagers experience so many changes physically, mentally, and even emotionally. So mental health at this stage, it shapes their self-esteem, their identity, how they handle stress from school, from friends, and even in their family. And next is for the adults. So mental health In this stage, it plays a big role in their work performance, in their family life, in decision making, and it affects how they balance responsibility, they manage stress, and maintain healthy relationship. And last is for the elderly. So in older stage, mental health helps individuals to adapt the changes such as retirement, loss of loved ones, or physical limitation. It also affects their memory, their mood, and even their emotional well-being. So in short, mental health is part of every stages in life, from childhood and to old age. So when we care of our mental health, we are also caring for our relationship, our productivity, and our overall quality of life. So as a conclusion to all of this, mental health is just as important as our physical health. So by understanding what mental health truly means, by correcting the false beliefs, recognizing its wide scope, we can promote a society that values empathy, awareness, and even healing. So let us always remember that asking for help is not a sign of weakness, but it is a step toward healing and strength. So thank you for listening. We may all continue to care for our minds as much as we care for our bodies.
Hello everyone again. Now that Miss Alison Maka discussed the overview of our topic, we will have a short game. Every member of the two groups will recite different habits and caring our mental health.
Take a break and spend your time. Prioritize relaxation. Set realistic goals.
Matulog pa. Playing sports and exercise.
Eating healthy foods.
Thank you participants for the cooperation and participating in our activity. Now that everyone was energized, let us start our discussion or our webinar.
Good day everyone. Today I'll be sharing a quick reminder how we can take care of our mental health. First, talk about your feelings. Opening up to someone you trust can enlighten the emotional load. Next, stay active. Even simple movements can boost your mood. Also, eat well and get enough sleep. These two have a big impact on your energy and emotion. Learn to manage stress through deep breathing or journaling, and always set goals that are realistic so you don't overwhelm yourself. And of course, limit alcohol, drugs, and caffeine, and don't hesitate to seek professional help if you feel you need it. For the prevention, remember to keep a healthy balance, work, rest, and your hobbies. Surround yourself with the positive people, practice healthy coping skills, and try to avoid negative thinking by focusing on gratitude. Stay connected with others and always educate yourself so you can recognize early signs of stress. Before I end, let me leave this message. Mental health is about balance, strength, hope. Let's practice self-care, support one another, and be kinder to ourselves every day. Thank you and take care.
Hello there again. Now that Mr. MJ Nazareno discussed the last part of the introduction of our topic, which is he discussed the things we should do to take care of our mental health problems and the precautions and prevent of mental problems. Now, let's tackle about our main discussion in our seminar, which is the anxiety. So, what is anxiety? Anxiety is an emotion characterized by apprehension and somatic symptoms of tension in which an individual anticipates impending danger, catastrophe, or misfortune. The body often mobilizes itself to meet the perceived threat. Muscles become tense, breathing is faster, and the heart beats more rapidly. Anxiety may be distinguished from fear both conceptually and physiologically. Although the two terms are often used interchangeably, anxiety is considered a future-oriented, long-acting response broadly focused on the diffuse threat, whereas fear is an appropriate, present-oriented, and short-lived response to clearly identifiable and specific threat. Now that we know the definition of anxiety and the difference between anxiety and fear, let's us talk about the characteristic of anxiety. So how we will distinguish if it is an anxiety. First one is the anticipation of danger. Anxiety often involves a feeling of dread or worry about a future event, which can be internal or external. Second one is the physical symptoms. Anxiety can cause the body to tense up, leading to a rapid heart rate, faster breathing, sweating, and restlessness. The third one is the emotional symptoms. It involves feelings of apprehension, fear, and tension. Other emotional symptoms include irritability, jumpiness, and anticipating the worst. And next is the response to stress. It is a normal reaction to stressful situation, such as facing a difficult problem at work or taking a rest. And lastly, the interference with daily life. When anxiety becomes persistent and overwhelming, it can interfere with your ability to function, leading to an anxiety disorder. So when we should need to seek a support from professionals. First one is if your anxiety is preventing you from doing things you enjoy. Second, if you feel worried or panic in situations that are not stressful, and if your anxiety is constant, overwhelming, and interfering with your daily life, and lastly, if anxiety can sometimes lead to other serious issues like depression or substance abuse. So it is important to get help if you are struggling. Now let us talk about types of anxiety. The first one is the phobia. Phobias are exaggerated fear of particular object, animal, or situation that does not pose a significant threat. Common phobia include fear of spiders, dentists, or flying, and airplanes. Phobias are the most common type of anxiety disorder. A person with a phobia will develop anxiety symptoms such as sweating, shaking, racing heart, and shortness of breath. Upon encountering the source of their phobia, many people with phobias will alter their behavior to avoid confronting their fear. More women and men are affected by phobias. While the second one is generalized anxiety disorder or GAD. GAD causes excessive worry about different activities, events, and people. With generalized anxiety disorder, the source of the worry changes, but the worry itself is present most of the time and is significant enough to interfere with the person's ability to function normally. Most people with GAD wish they could stop worrying, but they feel powerless to do so. The next one is social anxiety disorder. With this type of anxiety, people feel uneasy and self-conscious in social situations. They often have a deep fear of humiliation or of being negatively judged by others. People with social anxiety might experience blushing, sweating, trembling, nausea, or even panic attacks when faced with speaking in a group of meeting or new people. They might avoid social events to prevent these feelings. Early negative social experiences such as bullying or teasing can also contribute. The next one is the stress disorder. Acute stress disorder and post-traumatic stress disorder are triggered by traumatic events such as being in combat, a life-threatening event, a natural disaster, or an assault. They also share the same symptoms, including being easily startled, having recurrent flashbacks of the traumatic event, difficulty sleeping, nightmares, withdrawing from some people and particular events, and having intrusive thoughts about the event. Acute disorder is diagnosed when some symptoms persist for 3 to 30 days after the traumatic event. PTSD is diagnosed when symptoms persist for more than 1 month. In some cases, PTSD symptoms do not begin until 6 months or more after the traumatic event. And the next one is panic disorder. This condition causes periods or terror known as panic attacks, which often occur for no reason and without warning. and typically last between 5 and 30 minutes. During a panic attack, a person might shake, sweat, have trouble breathing, and experience chest pains. These attacks can occur during stressful events or appear out of nowhere. They can even happen during sleep. Women are twice as likely as men to develop a panic disorder. And lastly, the obsessive compulsive disorder or OCD. Many people with anxiety also have OCD. People with OCD have persistent, involuntary thoughts, worries, or urges. OCD might occur because of genetics and structural differences in the brain. People have had a brain injury also are at higher risk for OCD. Symptoms often are triggered by stressful experiences. There are three factors that causes anxiety. These are the biological factors, environmental and life factors, medical and substance related factors. The first one is the biological factors. It can be genetics. Anxiety disorder can run in families, suggesting a genetic predisposition, and brain chemistry naman is faulty circuits in the brain that control fear and emotion may play a role. The second one is the environmental and life factors. It could be the stressful events, major life events, or a build-up of smaller stressors such as death of a loved one, work stress, or financial worries can trigger anxiety. Second one is trauma. Experiences or witnessing traumatic events, especially in childhood, increase the risk of developing an anxiety disorder. Third one is the family and social environment. Difficult family relationship, social isolation, or societal pressure can also contribute to anxiety. And the last one of the environmental and life factors is the personality. Personality contains types may be more prone to anxiety. The next one, the next factors is the medical and substance related factors. The first one is the health conditions. Chronic illnesses like heart, lung, or thyroid conditions can cause or worsen anxiety symptoms. The last one is the medical and substance related factors. The first one of these factors is the health conditions. Chronic illnesses like heart, lung, or thyroid conditions can cause or worsen anxiety symptoms. The next one is the substance use. Alcohol, recreational drugs, and withdrawal from certain medication can both cause and worsen anxiety. And the last one is the medications. Some medications have anxiety as a side effect. And that's all the three factors that causes anxiety. So now that we're done discussing the causes of anxiety, let us know the common symptoms of anxiety disorders. This includes the insomnia or sleeping too much, feeling restless, tense or irritable, difficulty concentrating, racing heart and muscle tension, sweating, trembling and shaking, nausea, and having a sense of dread. In addition, many people with anxiety disorders also experience symptoms of depression. And to prevent anxiety disorder, there are strategies that may help to reduce the risk of anxiety. The first one is to getting regular exercise, practicing mindfulness, having supportive family environment, and reducing caffeine intake. Maintaining balanced, nutritious diet, keeping a regular sleep pattern, avoiding alcohol, cannabis, and other recreational drugs are very helpful for this. Checking with a health professional before using over-the-counter medication or herbal remedies are also helpful. In curing and healing anxiety disorders, there are three common methods to heal and to help on curing the mental disorder or the anxiety. The first one is the cognitive behavioral therapy or CBT, the most common type and psychotherapy for anxiety disorders. CBT helps people learn to reframe negative through patterns and to change their behaviors in situations that trigger anxiety. The second one is the exposure therapy. This type of therapy involves slow, direct exposure to the objects of a person's fears. This can be done through role playing or by imagining the feared object or situation. For example, people who are afraid of dogs might look at pictures of dogs and then imagine a dog crossing the room, then slowly coming closer. Feelings of anxiety should lessen with increasing exposure. This process can take days, weeks, or months. And lastly is the insight-oriented psychotherapy. This type of talk therapy explores how past and current experiences may be contributing to anxiety. It helps people deal with unresolved conflicts in their lives to lessen feelings of anxiety. Now that we're done in discussing on how curing and healing stage of anxiety, let's us know the self-help for anxiety that we can do just by ourselves. The first one is to exercise. Research has found that people who exercise regularly have lower stress levels, improve mood and sleep better, all of which can help reduce feelings of anxiety. The second one is mindfulness meditation. Mindfulness is the practice of focusing attention on what is happening in the present and accepting it without judgment. Mindfulness is often learned through meditation, a method of regulating your attention by focusing on breathing, a phrase, or an image. And the last one is relaxation techniques. Relaxation techniques such as deep breathing exercise, visualization, also called guided imagery, and body scanning, can help you learn to relax your body when anxiety occurs. So that's all. Thank you.
What is depression? Depression is a mood disorder where a person feels deep sadness and loses interest in things they used to enjoy. It also affects thinking, memory, eating, and sleeping. It's normal to feel sad sometimes, but depression is different because it lasts at least 2 weeks and comes with other symptoms. Without treatment, it can get worse, but the good news is depression is highly treatable. Types of depression. Major depressive disorder or clinical depression is the most severe type. Symptoms last at least 2 weeks. Persistent depressive disorder or PDD, mild to moderate depression lasting 2 years or more. Disruptive mood dysregulation disorder or DMDD, severe irritability in children. Premenstrual dysphoric disorder or PMDD, extreme mood changes before menstruation, and depression due to medical conditions caused by illness like hypothyroidism or Parkinson's. Seasonal affective disorder or SAD appears in fall or winter. Prenatal or postpartum depression occurs during or after pregnancy. Atypical depression, mood improves with positive events, includes rejection, sensitivity, and increased appetite. People with bipolar disorder also have depressive episodes. Symptoms of depression. Symptoms vary from person to person, but common ones include persistent sadness, hopelessness, losing interest in usual activities, irritability, eating too much or too little, trouble sleeping or sleeping too much, low energy or fatigue, difficulty concentrating, physical symptoms like headaches or stomach aches, thoughts of self-harm or suicide. Who can be affected? Depression can happen to anyone, adults, teens, and even children. It's more common in people with illnesses like Alzheimer's, Parkinson's, stroke, chronic pain, cancer, and other long-term medical conditions. How common is depression? Depression is very common. About 7% of US adults experience it each year. Around 1 in 6 people will experience depression in their lifetime. About 4.4% of children also experience depression. Many cases go undiagnosed because people don't seek help. How is depression treated? Depression is highly treatable with 80 to 90% of people responding well to treatment. Treatment options include psychotherapy, talking with a therapist to understand and manage thoughts and emotions. CBT is the most common. Next, medication. Antidepressants help balance brain chemicals. It may take time to find the right one. Complementary therapies like acupuncture, massage, hypnosis, or biofeedback can help with mild or persistent symptoms. And brain stimulation therapies like for severe cases, ECT, TMS, or EMS. And next, the lifestyle habits, regular exercise, healthy sleep, eating well, and avoiding alcohol, staying connected with loved ones.
Helping coping mechanism are the ways we deal with stress, sadness, or anxiety in a healthy way. They help us control our emotions and recover from difficult situations. And one helpful coping method is expressing emotions, talking to someone you trust, writing down your thoughts, or doing creative activities like drawing or music can help release stress and clear your mind. Mindfulness and breathing exercise can also help your thoughts. Taking a few minutes to focus on your breathing and the present moment reduces tension and helps you relax. Uh, Staying active is another great way to cope. Exercise, walking, or stretching releases hormones that improve your mood. And eating healthy foods, drinking water, and sleeping well also keep your mind strong. And social support is very important too. Spending time with family and friends reminds you that you're not alone. Positive thinking and focusing on solutions rather than problems help you stay strong and motivated. Preventing triggers and worsening mental health. Good mental health starts with being aware of what affects you. Everyone has triggers like certain situations or people that cause stress. Knowing what these are helps you manage or avoid them. Set boundaries and protect your peace. It's okay to say no when something feels too much or unhealthy for you. Follow a healthy routine. Get enough rest and eat properly. Stay active and doing things that make you happy. Small habits Small habits can really help prevent emotional burnout. Pay attention to early signs such as tiredness, mood changes, or loss of interest. Don't ignore this and talk to someone or seek professional help before it gets worse. And be kind to yourself. Take breaks when needed. Forgive yourself for mistakes and allow yourself to rest and heal. Supporting people with depression and anxiety. When someone you know is struggling, the best thing you can do is show that you care. Sometimes they don't need advice, just who will listen and understand. Uh, Start by reaching out gently. Gently, you can say, I've noticed you have been yourself lately. You want to talk? Listening with empathy can make a big difference. Uh, encourage them to seek help if needed. Offer to help them and find a counselor accompany them if they are nervous. And if they don't talk, and respect their space, but remind them you are there when they are ready. And even a simple message like, I'm here for you, can bring comfort. And remember, take care of yourself too. Supporting someone with mental health struggles can be emotionally draining, so make sure you also get the rest and care you need.
Now that my teammates discussed very helpful information, I want to grab everyone's attention and energize our body and minds. Now we will have again a fun game, a short game. And this game is titled Pass the Object. In this game, we will pass the object until the music stops. So kung kanino natapat o kanino napunta yung object, is magbibigay siya ng examples of healthy habits to reduce or to prevent the mental illnesses like anxiety and depression.
Stop! Okay, Miss Kaidoy. Stop!
Siguro kapag may nag-open sa akin, syempre, pagka alam mo sa kanila na they are loved, they are worthy, then they are enough, and nagmamatter sila.
Hey everyone, thank you so much for being such an awesome audience today. I really hope you got something valuable out of our discussion about our mental health, anxiety, and depression. We know that this is just the beginning and there's always more to learn. So, to help you continue on your journey to be better mental well-being, we've put together a list of resources that you can check out whenever you have the time. These are packed with info, tips, and ways to connect with people who can support you. Website: the National Center for Mental Health. Next, World Health Organization, and also mentalhealth.gov. So this is the hotline of NCMH. Crisis hotline 0917-899 USAP. In Touch Community, we offered +63-28893-7603, and also 0917-800-113. Lastly, 0922-893-8944. Thank you so much, everyone.